extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now look at the notes for extract 1. Extract 1, questions 1 to 12.
You will hear Dr. John Hope interviewing Brian Brown, who has come seeking treatment for a current problem.
For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning. Come on in, Brian, and tell me, how can I help you?
Oh, hello, Doctor. Look, I've come here because I've got a real issue with sleeping, and I was hoping you'd be able to prescribe with them sleeping tablets.
Well, just before we go straight into a prescription for tablets, I think it would be useful if you could just tell me a little bit more about your problem.
Okay, well, it relates to my work. I work at BP Oil Refinery and I do a lot of shift work, and because of that I've got irregular sleeping hours and I'm not sleeping well at all.
And how long has this problem been going on?
Well, I've been working at the refinery for about 3 months now.
Mm-hmm.
And I started night shift about 6 weeks ago and it's been building up since then.
And tell me more about your work hours.
Well, basically we do 12-hour shifts in the daytime and that's followed by 2 12-hour shifts in the night time.
And is this problem sleeping after the night shift, or is it no matter whether it's day or night?
Actually, I can sleep after the day shift, but after the night shifts I'm having a lot of trouble. I don't seem to be able to get more than 4 or 5 hours sleep after the night shifts.
Oh, that's no good. And how does this impact on your work?
Well, it's a problem because, my job's quite dangerous and we need to monitor a lot of equipment and operate some machinery.
Mm-hmm.
And I'm finding that I need to be alert, and when I'm tired, I have to resort to drinking a lot of coffee and lots of caffeinated drinks just to get through my shifts.
Right. Well, Brian, would you mind if I just went through and talked about what things we can do to help you sleep better? Because I think it's important that we do more than just prescriptive sleeping tablets.
Okay, I guess so.
Generally speaking, sleeping tablets are of short-term use only. What happens is that if we start you off taking sleeping tablets regularly, you're going to find over time you have to increase the dosage to get any real effect, and there's a real risk that you'll become dependent on them.
Well, look, I don't really care too much about that. It's now that I'm having trouble. What's important to me is that, I keep my job. You know what happened to me on my last shift? I actually fell asleep for 15 minutes and my supervisor caught me out there, and it was due to not getting enough sleep. So that's really why I've come here today.
Well, we'll go on to look about what we can do to help you over this immediate problem. But I'd like you to realise that with sleeping tablets, it's not only the fact that you may become addicted to them, but that it can actually impair your memory and your ability for critical thinking.
Really?
Now, you were telling me that you're working in quite a dangerous profession, and it's really important that you're alert, that you're not suffering a hangover from sleeping tablets.
Right, I guess I see what you're saying.
Now, Brian, I'd like to talk to you about what living environment is like, what your living environment is like. Where do you go to sleep normally? What sorts of things would make it difficult for you to get to sleep?
Well, the noise in the daytime, I suppose. There is a lot. We live in the suburbs, and if it's not one thing, then it's another. For example, a neighbour might start mowing the lawn in the daytime. We've got a lot of birds that wake me up. A lot of crows at the moment. They seem to hang around the house. Sometimes the phone rings. Even the brightness of the room, doctor, or the hot weather. All of these things have been disturbing me.
Extract 2. Questions 13 to 24.
In this part of the test, you will hear Nurse Melissa Sweet interviewing Mr. Jim Fisher, an elderly patient.
For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Firstly, let's look at the immediate needs you'll have when you go home. Now, at this hospital, we are a very good relationship with an organisation called Blue Care. Have you heard of Blue Care?
No.
Well, Blue Care is a church-based organisation which offers a variety of community services, and they aim at maximising the individual's independence and quality of life. Their staff includes nurses who can help you with some of your personal care like showering and shaving. They'll come every second day to check on your wound. What they will do is dress your wound, apply ointment, and help you with other medications.
But what about the cost? Because I'm on a pension, you know.
The good news is that these services are subsidised by the government, so there's no charge, and no one is excluded from receiving a service because of financial hardship. They also provide a range of other services, including social support, such as a chaplain for spiritual support, who can visit you if you would like that. And they also have volunteers who can call in for a chat if you want some company.
Yeah, well, I can see that would be a help.
Now let me ask you how you see your future. Do you want to continue to manage in your own home, or would you prefer to move to an aged care facility?
No, I want to stay in my own home. I'm just worried because I'm still recovering from this wound and I don't know how I'll manage to cook.
Let's just take this one step at a time. I can also arrange for an organisation called Meals on Wheels to bring in your meals.
Well, that sounds okay, but how does that work?
Well, they generally come in daily, 5 days a week. They provide one main meal per day, which is healthy and nutritious.
What about Saturday and Sunday?
Well, on Fridays, they provide extra meals for the weekend, which you can keep in the fridge. Now, for the longer term, we'll arrange for the aged care assessment team to make an appointment for a visit for you. Have you heard of this service?
No, I haven't.
The government has provided this service because they want to help and encourage you to continue to live in your own home as long as you are capable of managing.
I see.
The team, which might include a doctor, nurse, social worker, or other health professionals, come to your home and assess what your needs are and how you're managing. They assess your ability to manage on your own at home.
Well, as I said before, I'd like to stay at home. I've still got all my faculties, but I don't think my balance is all that good. So what would happen if I had a fall and no one was there?
Well, Mr. Fisher, do you have a safety rail in your shower?
No, I don't.
Well, you see, they can arrange for safety modifications like support rails in the bathroom and toilet or safety ramps where they're needed.
Well, that's good because, you know, it's a 2-storey house and I worry that I could have a fall on the steps.
Well, adequate support rails would be a consideration to make you feel safer. They can also organise a medical alert bracelet.
How does that work?
Well, this can be worn on your wrist. In an emergency, you press the button and a message is sent to the ambulance service who will respond quickly.
Yeah, well, I didn't really know there was all that help out there.
Now, I'll give you this set of brochures which tells you all about the services offered by Blue Care, Meals on Wheels and the Aged Care Assessment Team. And when you've had time to look through them, I'll call back to see if you have any more questions.
Nurse, there's just one more thing that I'd like to talk to you about.
What's that, Mr. Fisher?
As I said before, my old neighbours have moved away and our neighbourhood's changed a lot. So I do feel a bit alone, you know, and over the past year there's been several house break-ins in the neighbourhood.
Well, there is one other thing I could suggest.
Oh, what's that?
It's another government initiative called Home Assist Secure. And if you're over 60, which of course you are, you can receive advice and help relating to home safety issues.
Oh, what can they do?
The Home Assist field staff have been trained and cleared by the police to come to your home and offer you free information and assistance.
What kind of assistance?
Well, they can help you with security lighting outside your home. They can also install windows and door locks and security screens.
Well, that sounds like a good service.
And smoke alarms are another safety device that they can install in case of a fire.
Well, that's important.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Professor Roland Stalker heads the Vascular Biology Division at the Victor Chang Cardiac Research Institute in Sydney.
Now read the question.
Okay. So, Norman, what we found is that the enzyme in our body that produces bleach, its name is myeloperoxidase. We've known for many years that this is present in coronary lesions that have ruptured.
So let's back up a bit. We produce bleach in our bodies.
That's right. We produce bleach as part of our immune response to kill bacteria and other pathogens.
So the way is we squirt it around our toilet, it gets squirted around our body to kill pathogens.
That's right,
too.
and we have professional enzymes that produce bleach, yeah.
Okay, and the enzyme that manufactures it, if you like, is called myeloperoxidase.
That's right, and this enzyme we have known for a long time is present in coronary arteries that have ruptured and have caused a fatal heart attack. What we haven't really been able to do is to establish a cause and effect relationship between the presence of this bleach-producing enzyme and plaque rupture.
So what did you do?
So what we have been able to do.
Question 26.
Rebecca Lim is at the Hudson Institute of Medical Research at Monash University.
Now read the question.
Bronchopulmonary dysplasia.
Possibly not stem cells as a broader sense of the word, but what we think is happening is really the placenta with the amniotic sac that surrounds the baby during the course of pregnancy. We know that the human amnion has had, for well over a century now, amazing wound healing effects. So
really?
Oh yeah, absolutely. So
Give me
if you
an
go
example.
back. Yeah, so in 1910, it was a paper that I found trawling through. Do you remember what a library is?
No, it sounds familiar.
So I remember presenting this to a group of medical students because they...
Who'd never heard of a library before.
Who have never been in the university library, I don't think. So I did a little scan of this article that I found, and it was from 1910. So the use of the human amnion as a biological bandage. And then if you fast forward 100 years, there are still randomized control trial data out there showing that the human amnion is actually far superior to traditional bandages when it comes to wound care for third-degree burns and for skin grafts.
So what's in it? What's in the membrane?
Question 26.
Ewan McPhee is a national leader in rural general practice. He lives and works in Emerald in Queensland.
Now read the question.
It's My Health Record.
Well, look, the My Health Record in my practice is just, I guess, part of doing normal business, Norman. It's essentially an extension of my clinical record. So with a lot of my patients, I spend a lot of time making sure that my records are accurate, my medication lists are accurate, and your allergies and immunisations. Now, if you take, for example, one of my patients today, she's an elderly lady with multiple medical problems, and look, she pops in and out of hospital a lot. And it's important that, I have an up-to-date summary of what's happening with her, what her medications are, and her results. That the results in my practice are available if she ends up in hospital. And she came back from a sudden admission the other day. Basically, she came in without any information from the hospital, but because my health record's linked into the Queensland Health System, I actually had the discharge summary there with her medication changes available to me when she came in. So I was able to basically make changes and keep a point of truth for that patient around her health. And, that My Health Record has become for her.
Question 28. You hear.
The lead author was Lee Hooper, who's on Skype from Norwich Medical School in the UK. Welcome to the Health Report, Lee.
Now read the question.
So we were interested in the heart and the vascular effects. So we were interested in heart attacks and stroke and the sort of combined outcomes around whether we have events or any kind of cardiovascular event, any kind of heart event, and whether we survive them, but also all-cause mortality. So we were looking at death as well and whether they make us fatter and our lipids. So we looked at a whole range of outcomes that we felt were important around omega-3 fats.
So before we get to the heart findings, do they make us fatter?
No. Well,
that's good news at least.
We need to take them in relatively small quantities, so there's not. But they don't make us thinner, but they don't make us fatter either. So we're okay on that one.
So what did you find?
So, I mean, primarily we were interested in the actual heart and vascular effects. And basically what we found was they're not harmful, but they're not beneficial either. We see almost no effects. And we had a huge amount of information in the review. There was, as you said, 79 trials. We had over 112,000 people involved in those trials. And all of the people were involved for at least a year.
Question 29. You hear...
Peter Rothwell is Professor of Neurology at the University of Oxford.
Now read the question.
Okay.
Well, there have been a few strange observations over the years. So, for example, people had found that in the trials of aspirin, low-dose aspirin, that it seemed to prevent stroke very effectively in women, but not in men, whereas the old trials of high doses of aspirin seemed to work in men, but not women. And so one obvious possible explanation for that was it's just that it's due to body size, and that higher doses were needed for larger body size, i.e. men, but lower doses might be effective at lower body size. And so that was one of the clues to just look by body weight and obesity and lean body mass, just to see whether the effect did vary.
And you brought together the available studies.
Question 30. You hear
Associate Professor Lucinda Burns of the National Drug and Alcohol Research Centre.
Now read the question.
So when you drink alcohol, when you drink a lot of alcohol on a quite frequent basis, we can see the fetal alcohol, which, as you say, is the facial expression of various behavioural things and shortness of the child and other abnormalities. But with cannabis, we don't see those particular visual things, but we do know that there seems to be some behavioural issues that are shown. And the issue then again is, as I mentioned previously, is it is complicated by the other things that go on in the lives of women. So, for example, if they're not eating well and they're drinking, if they might be drinking, they're smoking, it's very hard to tease out the actual effects of the cannabis.
Because I think some of the research has suggested behavioural issues, developmental issues, and if they're exposed to cannabis later on, these same children can have compound side effects from tetrahydrocannabinol. But you're arguing that they're so impure, these studies, you just can't tell.
That's exactly right. And these are exactly the same.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, Choose the answer A, B or C which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1, questions 31 to 36.
In this part of the test, you will hear a lecture based on the subject of chronic obstructive pulmonary disease.
You now have 90 seconds to read questions 31 to 36.
Chronic obstructive pulmonary disease, COPD, is a growing global epidemic that is significant in both developed and developing countries. Morbidity and mortality from COPD will rise as populations age. Furthermore, as the mortality from cardiovascular and infectious diseases falls, the occurrence of COPD will become more common in society. This is supported by the current trend, which indicates that more people are dying from COPD each year. In addition, COPD is associated with several other diseases such as osteoporosis, diabetes, glaucoma, and sleep disorders. In Australia, almost 1 in 5 people over 40 have COPD, and it's the 4th most common cause of death in men and the 6th most common cause of death in women. Smokers, or past smokers, are those who are at major risk of getting COPD, and most people with COPD have smoked at least 10 to 20 cigarettes per day for 20 or more years before experiencing any symptoms. As a result, COPD is typically not diagnosed until the 5th decade of life, meaning in people aged 40 to 49 years. So who can get COPD? Well, whereas cigarette smoking is the commonest form of COPD in developed countries, it's also seen in non-smokers, particularly in developing countries, which may be due to the other causes of COPD, which include occupational dust and fume exposure, exposure to outdoor and indoor air pollution, including tobacco smoke, poorly ventilated living environments where pollution is present, often due to the use of solid fuels for cooking and heating, individuals who have a genetic predisposition to COPD, or individuals with a history of recurrent childhood respiratory infections. In addition, some people with COPD have worked or lived in places that were very dusty or smoky for many years. COPD is primarily characterised by the presence of airflow limitation resulting from inflammation and remodelling of small airways, and is often associated with emphysema, The common symptoms are repeated coughing, feeling puffed or shortness of breath when doing things like climbing stairs, walking up a hill, or even having a shower, a build-up of phlegm in the lungs, or chest tightness. With COPD, your lungs become larger than normal, so the breathing muscles around the outside of the lungs, such as the diaphragm and chest wall muscles, become stretched and have to work harder. This means that there's more effort involved in breathing, and it makes you feel breathless. It's increasingly recognised that COPD extends beyond the lung and that many patients have several systemic manifestations that can further reduce quality of life. So how is COPD diagnosed? COPD is tested with a simple breathing test using a spirometer, which records the amount of and the rate of air that you breathe in and out over a period of time. It's essential the procedure is carefully and clearly explained and to actively motivate the patient to perform at their maximum level. The volume and flow parameters measured are defined in terms of maximum effort and maximum exhaled volume. It's preferable for the patient to sit upright in a chair, as this is the most stable position should the patient experience dizziness during the test. The key steps are as follows. First, breathe in fully and the lungs must be absolutely full. Seal the lips around the mouthpiece and blast the air out as fast and as far as possible until the lungs are completely empty. Repeat the test until 3 acceptable results are obtained, up to a maximum of 8 efforts. The results can measure the presence and severity of COPD. The severity of COPD is categorised into 3 levels. Mild, where the breathing capacity is 60 to 80% of normal. Sufferers feel a little out of breath if they work hard or walk rapidly, especially on hills and stairs. Moderate, where breathing capacity is 40 to 60% of normal. Sufferers feel out of breath if they walk rapidly and they may have trouble doing physical activities. Severe, where breathing capacity is less than 40% of normal. Sufferers probably can't work or do household chores and have difficulty in walking upstairs or across the room.
Now look at Extract 2. Extract 2, questions 37 to 42.
In this part of the test, you will hear a lecture based on the subject of migraines.
You now have 90 seconds to read questions 37 to 42.
The word migraine is derived from the Greek word meaning pain in half the head, as migraine often produces a unilateral or one-sided headache. It is a common and distressing disorder, and although they are not likely to take life, migraines can destroy the quality of life. Studies have shown the incidence of migraine to be in the range of 9 to 10%, and it affects 17% of the female population and 6% of the male population. So, about 2 million Australians can expect to suffer from migraine, and that translates to 1.5 million women and about 500,000 men. It is thought that more women suffer migraine than men due to hormonal factors. There are several types of migraine, the two main types being classical migraine and common migraine. Classical migraines are preceded by an aura, the duration of which varies between 15 minutes up to almost an hour. The headache usually lasts 6 to 8 hours, although they can last up to 72 hours. Common migraines are not preceded by an aura, and the headache lasts between 4 and 72 hours and can be pulsating and unilateral. An upset stomach and vomiting are common symptoms. Migraines can be divided into a number of distinct phases. The first phase includes the early warning symptoms. A significant number of migraine sufferers experience warning symptoms for up to 24 hours before the attacks start, but may not recognize these signs unless they know what to look for. The common symptoms include changes in mood, and these moods can vary from elation, such as feeling on top of the world and full of energy, to opposite moods, such as feeling depressed and irritable. There are several abdominal symptoms common to migraine, including nausea, changes in appetite, such as intense hunger or sugar craving, constipation, and diarrhea. Neurological changes may also occur prior to the migraine, including drowsiness, incessant yawning, symptoms of dysphagia, such as difficulty in finding the right words, a reaction to excessive brightness or sound, and difficulty in eye focus. There may also be changes in behaviour, such as hyperactivity, clumsiness, or lethargy. And many sufferers report muscular symptoms, such as general aches and pains. The second phase is the aura. The aura accompanies migraine attacks in about 20 to 30% of migraine sufferers. The most common aura symptoms are visual disturbances such as bright, zigzag lines and flashing lights. As well as that, there may be difficulty in focusing or blind spots. The aura commonly affects only one eye, but it can disturb the visual field of both eyes. It usually lasts between 5 and 60 minutes, then the vision normally returns to normal. Less commonly, aura affects sensation or speech. The third phase is the headache. The headache phase can last for up to 3 days. It is often throbbing and on one side of the head, but it can affect both, and it is made worse by any kind of movement. The most common accompanying symptoms in this phase are sensitivity to light, sound, and smell. Eating can help reduce symptoms, especially starchy foods such as breads and pastas. The symptoms can be more distressing than the headache itself. The final recovery stage may last for about 24 hours, and feelings range from complete lethargy to feelings of high energy and even euphoria. Sleep often is beneficial for adults, while effective medication can improve attacks for chronic sufferers. Children seem to feel much better after vomiting, and for a few, nothing works except the headache burning itself out. The dietary triggers include alcohol, especially red wine, certain types of food, notably aged cheese or chocolate, withdrawal from caffeine or caffeinated drinks such as coffee and tea, the food additive monosodium glutamate, dehydration, and inadequate meals. Environmental triggers include bright sunlight, flickering lights, strong smells, for example, perfume, gasoline, chemicals, smoke-filled rooms, and certain food odours. Another environmental trigger is high altitudes or flying. Weather changes can be a trigger factor, as can loud noises or overuse or incorrect use of computers. Other trigger factors include the hormonal triggers. Hormonal fluctuations are implicated as a significant trigger for women, as 3 times as many women suffer from migraine headaches as men. This difference being most apparent during the reproductive years. The hormonal triggers may be menstruation, and a UK study found that 50% of women are more likely to have migraine around menstruation, ovulation, use of oral contraceptives, pregnancy, and it may be worse for the first few months, but in 2/3 of women it improves in the latter part. Hormone replacement therapy, and menopause.
That is the end of Part C. You now have 2 minutes to check your answers.